Hi, my name is slor, and my presentation for today will be about diabetes type 2. So first, what is type 2 diabetes? Well, type 2 diabetes is a chronic disease in which people have problem regulating their blood sugar. Basically, our bodies break down food we eat into glucose and other nutrition needed to keep our body functioning. The glucose level in the body rises after a meal, and this triggers the pancreas to make hormones, insulin, and release it into the bloodstream. For people with type 2 diabetes, the blood cannot respond to insulin properly. When your blood becomes insulin resistant, glucose will start to build up in the blood, which leads to type 2 diabetes. Now, how many are affected? In the United States alone, there is estimated over 29 million children and adults that have some kind of diabetes. As you can see here at the slideshow, the number of these, the majority are the estimated people have type 2 diabetes. Next, how do you know if you have type 2 diabetes? Well, first off, you will need to ask your parents to see if they've had any family history of diabetes. Second, go to a clinic to get tested, a local clinic where you're at. Lastly, be honest and ask yourself if you have been living a healthy lifestyle. Now, for those of you whose parents do have history of type 2 diabetes, you're categorized as genetic. And for genetic type, just because your parents have type 2 diabetes, that does not mean that you will have it too. It just simply means that you're at a greater risk of developing this diabetes. And for those of you who have not been eating healthy, you are considered developmental. This means that you have not been eating healthy and can develop type 2 diabetes. Now, there are multiple cells, organs, and tissue that are affected by type 2 diabetes. One of the cells affected are called fat cell. As you can see here, with fat cell, it can make hormones to affect your insulin and prevent it from working. Fat cell will continue to grow as it gets larger. It will block how your hormones produce and the more insulin resistant your body becomes. Another area affected by type 2 diabetes is your muscle tissue, and cell. When the muscle tissue throughout the body become resistant to insulin, it won't be able to make up energy needed for the body. When your body does not have enough insulin, it affects your glucose within the blood, which cannot get into your muscle cell to supplies for it. Lack of glucose will cause the muscle cell to die, and that will lead to loss of muscle strength. And also, another organ that is affected by type 2 diabetes is the stomach. The stomach is to break down food and transfer it through the small intestine. Diabetes can affect the stomach if the nerve controlling the stomach are damaged by high blood sugar level. In the stomach, the vagus nerve are the one that help control the movement of the food digestion tracts. When the blood glucose level continues to stay at a high level over a long period of time, it can cause the vagus nerve to become damaged. When the vagus nerve is damaged, it can stop working. When that happens, the muscle of the stomach and intestine will not work properly, and that can cause the food digestion to slow or even completely stop. Next piece of the organs affected by type 2 diabetes is the liver. The liver is the main resource for the body glucose reservoir. The liver stores and produces glucose to the body as needed and help control the blood sugar level. But with type 2 diabetes, the process can be off schedule. When these are off schedule, your liver will not be able to send glucose to the organs. About 85% of the people with type 2 diabetes have fat in their livers. When you have fatty liver, diabetes is harder to control. Diabetes is not a leading cause of liver cancer. Kidney. Kidney helps remove glucose from the bloodstream. With high blood sugar level, it can slowly cause damage to your kidney. With diabetes, small blood vessel in the blood become damaged. When the blood vessel become damaged, your kidney cannot clean your blood properly. Your body will retain more water and salt than it should. This can result in weight gain and kidney disease. And the last piece of organ affected by type 2 diabetes is your brain. It depends on how long you have this diabetes, but studies show that people with type 2 diabetes are at a greater risk for stroke and brain sinkage. This sinking of the brain can cause some serious problem. They found that patients with long history with diabetes have a brain volume loss. With brain volume loss, you can lose some very important functions such as your hearing, memory, emotion, eyesight, speaking, and self-control. So as you can see, why having uncontrolled type 2 diabetes is very bad for your brain. Now, type 2 diabetes can lead to a serious health complication. So it is very important to know the sign, symptom, to get treatment early. Type 2 diabetes are based on your needs and the doctor's recommendation. There are certain medication that is right for you, and it will be based on your current health and any condition you might have. Other treatments include insulin injection, which is a pen-like device used to self-inject through your stomach to send insulin to help your body manage the sugar level. It is important for people with type 2 diabetes to stick with the treatment that works best for them. Now, with type 2 diabetes, there are short and long-term complications. First, for the short-term complication, it is hypoglycemia. That is when your blood sugar drops to a low and dangerous level. Without sugar, your body will not be able to function normally, and this can lead to faintage, seizure, or even go into a coma. Now, for long-term complication, you can develop certain diabetes disease and condition that will affect part of your body. And that includes the eye, kidney, nerves, heart, feet, and blood vessel. You will need to check your blood sugar level to see how you are doing. You'll want to avoid having heart disease and stroke. Don't worry, there are ways to prevent type 2 diabetes. By eating right and being active, it can prevent or delay and help control your diabetes. Eating healthy with food choice of low fat and calories. Also, eating more fruits, vegetables, and whole grains. You should be doing at least 10 to 30 minutes of exercising daily. It's never too late to start. Just make a few simple changes in your lifestyle now, and it may help you to avoid diabetes complication. Many people live without knowing they have type 2 diabetes. And type 2 diabetes can occur in anyone. So it's very important to get a regular checkup with your doctor. People with type 2 diabetes need to learn how to monitor their blood glucose and the problem it can cause. It is very important to know the sign, symptom, and how to increase your chance of preventing type 2 diabetes. I encourage you to follow your health, the meal plan, exercise, and so you can avoid serious complication in the future. Thank you for listening to my presentation for today. And the last piece will be my reference. And these are where I got my information from. I enjoy doing this research, and I hope you enjoy listening to my presentation as much as I did. Thank you for your time. You have a nice day.